Dr. Dominic DeFelice from Highland Family Medicine is with us. Doctor, it's great to see you. Good morning.
Great to see you, Mark. Thanks.
State budget is due April 1st, and a lot of folks might be surprised to hear that state legislators are considering a number of items that could change health care here in the state. You've got your eye on this, don't you?
Yes, I do. So this is the time of year where the legislative bodies in the state, which includes the state assembly and the state senate, they hold session and consider these items, and there are a number of things being considered that affect health care.
Let's talk about some of the more pressing issues this morning, and I imagine that some relate to the COVID pandemic. We're still dealing with that at this time.
Back when the pandemic started, there was an executive order across the state that allowed primary care doctors to receive essentially equal pay for visits done via telehealth versus visits done in person. It was called a pay parity bill. And that was done, again, via emergency executive order. And that was a big win for primary care doctors. It allowed us to keep our doors open. It allowed really our most vulnerable patients, those with immunocompromising conditions, those who had child care needs or just didn't want to risk coming to an office, allowed us to provide care to those folks. That's actually still been in play ever since the start of the pandemic, and now there's a proposal to keep that going long term. That would be a big win. The second that I'm aware of that would greatly affect healthcare is essentially a system that would set up a New York statewide database of vaccines given to adults. It would just allow us to more easily track what was given to who and at which places. There's already a system like that for kids, and it works great, so just transitioning that to adults too.
There's a proposed bill called the New York Health Act. What would this do?
So this is probably the biggest, most important one being considered. It's been considered for a number of years. It would essentially make all of New York State a single healthcare payer, similar to how other countries do it, countries like Canada or Denmark or the UK, where anyone and everyone that lives within the borders have access to good quality, affordable health care. It's been a great idea. It's been proposed a number of times. Many, if not most, doctors in the state are on board with this. It would be a healthcare cost saver, and it would get just a lot more people the care they needed. So hopefully that one does go through.
There's also another proposal looking to address the cost of health insurance. How would this work?
Right. So this is somewhat in its infancy. There's a group of doctors that have come together and said, if we don't have the New York Health Act and we're kind of forced to work with all these different insurance companies, we've got to find a way to rein in the cost. So it would do a couple of things. It's proposed to make all insurance companies in the state agree on costs for things like deductibles and co-pays and premiums. It would also put in place a precedent or a requirement that insurance companies, if they wanted to raise premiums, they would have to hold hearings to do that. Again, all to just kind of contain some of the ballooning costs.
We know you're watching it. We will now as well as the budget season wraps up. Doctor, thank you. If you missed any of this conversation, we'll have it online as well at rochesterfirst.com.